Yes, hi everyone. Am I audible? Am I audible, guys? Yes, hi everyone. Am I audible? Am I audible, guys? Yes, right. So, how is your preparation going on? Basava, Jaigur, Shashank Pujar, Charan, yes, Malini. So, how is the preparation going on? You must be under some stress. Okay. Hmm? I can imagine the amount of stress you are undergoing right now. Physiology. Some student they think or they feel the physiology is more uh, difficulty. They feel more difficulty in physiology than anatomy. Hmm? Some student in anatomy, some students in biochemistry. So, what is your opinion about this, Malini, Shashank? What do you think? Is it anatomy difficult? Is it biochemistry difficult or physiology? Hmm? Very nice. Okay, Malini, Charan, good, great. So it should be nice all the time. Okay. So don't take unnecessary tension. Don't take unnecessary anxiety. So that will not help you in any of the exam. ಸುಮ್ಮನೆ ಆಂಗ್ಸೈಟಿ ತಗೊಳೋದ್ರಿಂದ ಸೊ ಟೆನ್ಷನ್ ತಗೊಳೋದ್ರಿಂದ ಏನು ಸಿಗಲ್ಲ. ಇನ್ಸ್ಟೆಡ್ ಆಫ್ ದಾಟ್ ಯು ಜಸ್ಟ್ ರಿವೈಸ್ ಫ್ಯೂ ಥಿಂಗ್ಸ್ and practice some diagrams. Okay, go through the PYQs, basically previous year questions. So that will give you some confidence. Hmm? Yes, Malini is telling, sir, physiology is not so volatile like anatomy. Okay. Charan is telling, sir, all is well, I can do it. Okay. Great, Charan. Great. All is well, I can do it. And it is a conceptual subject. Yes. Likit Balakrishna, biochemistry ಸ್ವಲ್ಪ ಜಾಸ್ತಿ ಟಫ್ ಅನ್ಸುತ್ತೆ ಸರ್ ಅಂತ. Okay, good. So biochemistry, if you ask me, it is very easy for me actually. But some student they say, sir, biochemistry is like a very hard anta. Very hard, sir, agala anta. So fine. So all is well. Okay, and you can try your level best. Don't worry. One day tomorrow is there, Sunday. Sunday you can study around 10-12 hours. So you can study up to 11-12 o'clock tomorrow, and you can get up at 6 o'clock and you can study more. So as usual, physiology 1. After that, you will be having, I think, 3 days gap is there for physiology 2. So, and we are there to help you. Don't worry. Yes, so okay. Chalo, now I think in last class we discussed about 20 important questions that can be asked in upcoming exam, like short essay and long essay. And today I have 20 more questions, and this can be 3 marks question as well. Yes, let's start. Shall we start, all of you guys? So all of you just type in the chat box, all is well, I'll try my level best. All is well, I'll try my level best. Type this in chat box. Type this. Come on, guys. Come on. Keep writing. Keep writing. Because it is one of the difficult day for you. The first year. The anatomy is over. Physiology. And don't distract yourself. Anyway, after exam, we'll be having 10-15 days holidays there. You can go home, you can enjoy with your parents, you can enjoy, you can do multiple things. But right now, your concentration should be on physiology 1. So once you complete physiology 1, then physiology 2, then biochemistry 1, biochemistry 2. 1 or 2 days you can relax. After that, you can start preparing for the first year practicals. Okay, then there will be holiday, second year. Okay, life continues like that. Okay. Yes, Charan, all is well, I can do it. Hari Prasad, EdCam, sir, EdCam to not done. Okay, today. Shashank Pujar, okay, fine. Likit Balakrishna, sir, all is well, I'll tell my best. Okay, Malini, yes, all good, all well. Okay, let's start. Let's start, guys. So the first question So that is it's all taken from the previous year papers. So around 10, 12 papers, and also from the RGUHS model paper. So this is one frequently asked question. Respiratory lung volume and respiratory capacity. So respiratory lung volume and respiratory capacity, very important question. So as you know, there are 4 respiratory lung volumes and 4 important respiratory capacities. Can anyone answer what are the 4 lung volumes and 4 capacities? So what are respiratory lung volumes? Volumes and capacities. Capacities. So let's see. Let's make it interactive, guys. Let's make it interactive. So lungs, very important. Hai. So as you know, in COVID-19, the COVID-19 is a disorder. So that was affecting our lung. Lung is very important for respiration. So my question is, what are lung volume and what are lung capacities? Yes, yes, come on, guys. Okay. So Malini is telling, sir, it is tidal volume. First is telling it is tidal volume, TV. So TV, TV, what is that? TV 500 ml. Remember TV 500 ml. So TV, yes. Then she said, sir, IRV. So IRV, inspirator reserve volume. Then she said, sir, ERV, ERV. And one more she said, sir, RV. So RV. Okay. So IV, sorry, IRV, TV, ERV, and RV. As you know, RV 1200 ml. Tidal volume 500 ml. You can remember TV 500 TV, like that you can remember, or 500 discount in TV. So TV, that is usual, that is 500 ml, and RV, that is around 1200 ml, and IRV and ERV you need to define. Basically you need to define and you need to tell what is the normal value. So there are basically 4 volumes. There are 4 capacities as well. So what are 4 capacities? Shashank, Pooja, what are 4 capacities? Capacities, let's see who is going to answer. So Malini, very good. So inspiratory capacity, IC, है ना? Then vital capacity, total lung capacity, TLC, IC, VC, TLC, and one more. What is one more? One more, guys. So you can see here. So there are 4 capacities. So one is inspiratory capacity, IC, I said. So IC is equal to TV plus IRV. TV plus IRV, tidal volume and the inspiratory reserve volume. Vital capacity, TV, IRV and ERV as well. ERV as well. Functional residual capacity, that is ERV plus RV. Total lung capacity, that is around 6 liter. So that is including all the values. Okay, IRV, TV, ERV and RV. So this is basically overlapping. The capacities are overlapping and lung volumes are not overlapping. Okay, this is very important to rule out obstructive lung diseases and also restrictive lung diseases and all. So chronic bronchitis, emphysema, tuberculosis, asthma and all, right? So there are 4 lung capacities and 4 lung volumes. Okay. Now let's see what is tidal volume. So tidal volume is air inhaled and exhaled during quiet breathing. Like this, quiet breathing. Quiet breathing, aram se breathing. Tidal volume andre aram se breathing. 500 ml. 500 ml will go out and come in. Right? Yeah. So inspiratory reserve volume, maximum volume in excess of normal inspiration. Okay, maximum value, excess of normal inspiration. Remember, it is inspiration. After normal inspiration. So that is basically IRB. Same way expiratory, normal expiration. Normal expiration. This is the area of confusion. So definition, very important. So normal inspiration and above that is the inspiratory reserve volume. Normal expiration and below that, that is the expiratory reserve volume. Residual volume, the volume remaining after maximum expiration. Okay, so that's around 1200 ml. This is very commonly asked in the exam. So all of you write in the chat box. So there are 4 volumes, 4 capacities. Write this in chat box. So whenever question asked, try to memorize. Sir, 4 lung volumes are there and 4 lung capacities are there. Lung volumes are non-overlapping, but lung capacities are overlapping. Total volume, that is around 6000 ml, and residual volume is 1200. Tidal is around, I know, that is 500. Okay, yes. So write this in chat box. So Malini, 4 volumes and 4 capacities. Okay, Bhima is telling, sir, I attempted for 55 marks in anatomy paper 1. How much marks would I expect? Okay, please reply. Okay, beta 55 andre on 35 ಬರ್ಬೋದು, maybe 40. Okay, even I don't know what was the level of accuracy in the answer. If it is really accurate answer, you will get 40 plus. If it is average answer, 30 plus. If it is below average, then it is 20 plus. So this is how actually. So 4 volumes, 4 capacities. 4 volume, 4 capacities. Okay. Paper correction liberal. No, Harishas, it is not liberal. One of the most difficult strict universities is RGUHS. In comparison with Maharashtra and other universities, RGUHS is a bit strict only. So, but now the passing percentage is 40, 40, 60, and then there are only 2 corrections, 1 and 2. So no problem, I think you will definitely pass. You don't worry about that. So this is okay, understood. This is very important one. Okay. Shashank, understood? This is probably a pakka question in exam. Lung volume, okay, you can see here, there are 4. And lung capacities, there are 4. And look at the lung, okay, look at the lung, right and left lung. Okay, you can write this diagram, basically this diagram. In exam, you have to write this diagram. So this is very, very important diagram. You must write. So they start with the 0, then 6000, that is on the y-axis. So you can show the total lung capacity. So you can see here the total lung capacity is around basically 6 liter. Then vital capacity, that is above the residual volume. Then functional residual capacity, and above that is the inspiratory capacity. Then you can show residual volume, expiratory reserve volume, tidal volume, inspiratory reserve volume. It's a very simple question actually. But in exam, you must write about few points about obstructive and destructive diseases. So this is one very important concept. So whatever we discussed in the beginning, that is actually very basic. Now you can write few points about clinical aspects of the physiology. There is something known as chronic bronchitis. Okay, there is something known as emphysema. So chronic bronchitis is also known as blue bloaters. Okay, blue bloaters. Blue bloaters. Emphysema is known as pink puffers. Pink puffers. Pink puffers. Why? Because blue bloaters, because there is a cyanosis. So in case of chronic bronchitis, you will see elevated hemoglobin. That can be polycythemia. There can be cyanosis, peripheral edema, rhonchi and wheezing. So rhonchi, wheezing, peripheral edema, cyanosis, elevated hemoglobin, all these are basically features of blue bloaters. So this is basically very commonly seen in case of smokers. So chronic smokers, the chronic bronchitis is very common. So, and there will be daily productive cough for about 3 months or more. So that is chronic bronchitis. Emphysema basically due to various causes. So there will be dilation of the alveoli, or expansion of the alveoli, and there will be rupture of the alveoli one day. So what we can see here, it's a pathological diagnosis. Permanent enlargement of the and destruction of air spaces distal to terminal bronchiole. This can be MCQ. So emphysema affects the area below the terminal bronchiole. So on an X-ray, we'll see hyperinflation with a flattened diaphragm. There will be severe dyspnea and quiet chest. So this is known as pink puffers. So pink puffer, that is emphysema. You can write this point in exam. So I'll have to write in the chat box, chronic bronchitis is equal to blue bloaters and emphysema is equal to pink puffers. Pink puffers. You can write this in chat box. Supreet, what if I fail in MBBS exam? At least tell. Oh, nothing will happen. You don't worry, Supreet. There will be supply exam. So there will be supply exam after 1 month, 1.5 months, or 2 months. So you can study seriously. Then you can join, if you want, you can join some coaching class and take the coaching class and study very seriously. You will definitely pass in supply. So no matter. But you must do 100% hard work. for upcoming supply exam, because if you fail in supply, then you are going to lose 1 year. So ನಿಮ್ಗೆ 1 ವರ್ಷ ಲಾಸ್ ಆಗುತ್ತೆ. ನಿಮ್ಮ ಜೂನಿಯರ್ ಬ್ಯಾಚ್ ಜೊತೆಗೆ ನೀವು ಎಕ್ಸಾಮ್ ತಗೋಬೇಕಾಗುತ್ತೆ. ಓಕೆ ಸುಪ್ರೀತ್, ಸೊ even if you fail one subject, no, to enter second year, you need to pass all the 3 subjects. So if you fail in one subject in the regular exam, you can take supply exam after 1 month or 2 months. If you clear, then you can enter directly into the second year. So no problem. There will be few classes you are going to miss. That's you don't worry. So Preet. Okay, that's fine. 50 is you are getting 50. No, you should be happy, Bima. Be happy, guy. Be happy. You don't worry. Don't worry now. Now concentrate on physiology. Why are you worrying about anatomy now? Why are you worrying about anatomy? Already over is over. Past is past. Present is present. Why are you worrying about anatomy? Why are you worrying about anatomy 1, anatomy 2? That is over now. Past is past. Okay. The present is physiology. Okay. You don't worry about the future also. Biochemistry also. Now you concentrate on only physiology. Okay. Okay, Bhima. Say yes. Say yes. I can do it. Type in the chat box. No, I think you will get holiday after practicals. So there will be 1 or 2 weeks gap will be there between practical exam and your then the results. So 2 days, 2 weeks, fine that is. Okay, Bhima. Okay, Bhima, great. Bhima, same here. Same here. So chronic bronchitis is equal to blue blotter, emphysema is equal to pink plugger. Okay, Charan, excellent answer. Excellent answer. We'll attempt carry marks. No carry mark. Nothing. Okay, now look at this. Now can identify these 2 pictures, A and B. A and B, all of you guys, A and B. He is a chronic smoker. So, and he is also a smoker, or he is having some alpha-1 antitrypsin deficiency basically. Can identify pink and the thin. You can see here cyanosis and edema is there. So what is this A and B? A and B, guys. Do people fail? Okay, around 20% they fail in the main exam. So don't worry. You call me after your all the practical exam. We'll have a discussion. You don't worry now. Don't worry now. Don't waste time now. Chalo, guys. So this is okay. A and B. A and B, all of you guys. So Malini is telling says emphysema. Very good. And B is basically that is chronic bronchitis, right? Good answer. And also don't forget, remember this picture. Remember Shah Rukh Khan. Remember cigarette smoking. Cigarette smoking can lead to chronic obstructive lung disease. COPD, one of the common causes of COPD is that is the air pollution, smoking, and many causes. COPD common cause is cigarette. That is basically cigarette. Chalo, ठीक है. Okay. So next question. Next question comes is conductive system of heart. I think this is very basic question. Conductive system of heart. So SA node, AV node, bundle of His, Purkinje fibers and all you can write. So can anyone tell me other than this SA node, all this conductive system, SA you will mention, AV node you will mention. So bundle of His. So bundle you will mention, and you will mention Purkinje. So other than this, any other bundle? Yes, Purkinje, you know, highest, that is 4. The velocity that is 4 around. So in case of Purkinje. So the slowest in AV node, that is also MCQ. So can anyone answer other than this? Any other bundle? Internodal bundles between AV node and SA node, and any other bundle other than this? Tuberculosis, yes, tuberculosis also can be a risk factor. Okay, tuberculosis also chronic obstructive lung disease. Okay. So in exam you need to write about this diagram. Okay, this diagram. You need to write about the SA node. Then you can write about the AV node, that is AV node, and you can write anterior internodal tract. Anterior internodal tract, middle internodal tract, posterior internodal tract. So this you have to write. And Batchman bundle. So Batchman bundle. Then comes is your right bundle branch and the left bundle branch. Then there will be conduction. So finally there will be Purkinje fibers. So the velocity is highest in Purkinje fibers, MCQ asked in RGUHS. You can see here. So SA node and Purkinje fibers, it's around, you can see here, it's around 4. It's around 4 here. Okay. It's very simple. And in exam, there can be a clinical scenario from heart failure, right heart failure and left heart failure, LVF and RVF. So left heart failure, there will be paroxysmal nocturnal dyspnea. Paroxysmal nocturnal dyspnea. So nocturnal means night. Dyspnea means difficulty in breathing. And all of you write LVF is equal to PND. LVF is equal to PND. Paroxysmal nocturnal dyspnea. Write this in chat box. Charan, keep writing. So offline students, keep writing this. We discussed many times in the class. Elevated pulmonary capillary pressure, capillary bed pressure. So there can be cough, crackles, wheezing, sputum, tachypnea and all. And there can be orthopnea, that is dyspnea on supine position, confusion, tachycardia, exertional dyspnea and cyanosis. So all these are the features of left-sided heart failure. This can be a clinical question. All of you write LVF is equal to PND, that is paroxysmal nocturnal dyspnea. Okay, good. Keep writing. Keep writing. Good. That's great. So, chalo, one more clinical. All of you, especially RS7 students, this can be very important question. This can be very important question. This can be a clinical based question in upcoming exam. LVF, left heart failure. Okay. Then right heart failure. Let's see what are the features of right heart failure. So right sided failure or right heart failure, that is known as carpulmonale. So all of you write RVF is equal to carpulmonale. Carpulmonale. Write this in chat box. Write this in chat box. This is very important. So what are the features again? Same fatigue, but here peripheral venous pressure. There can be ascites. So ascites, that is accumulation of fluid in the peritoneal cavity. Enlarged liver and the spleen. Enlarged liver and the spleen. So there can be a distended jugular veins. So jugular venous pulse, very important question. So JVP, very important question. There can be anorexia, there can be swelling. So swelling can be seen in case of right-sided heart failure, carpulmonale. So this can be asked in our exam. Okay, RVF is equal to, that is, okay, carpulmonale. So JVP, what are the positive and what are the waves in JVP? JVP, very important guys. So just go through today after the class. So what are the positive waves and what are negative waves in JVP, and one or two clinical condition. No, Canon A wave, absent A wave, like that. So you can just go through few conditions of abnormalities of JVP. So very important. So what are the positive and what are negative waves? So let's see who is going to answer. JVP. Yes, Malini is telling sir positive waves are ACV. ACV. Good. Then what are negative waves then? ABC, ADC. अच्छा ACV करेक्ट. A कहाँ से आ गया? D कहाँ से आ गया? अच्छा D. हाँ X and X prime. X and X prime. So this is very simple. D तो नहीं है इसमें. शशांक पूजर D दिया. D लालवा. हाँ ACV. हाँ X Y XX. Okay prime. That's okay. That's fine. ठीक है. So this is okay. Heart failure. Second question. Conductive system of heart. Okay. Next important question. One of the very difficult question. Buffer system in the kidney. Buffer system in the kidney. See, normal pH, normal pH is 7.3.0, 7.45. So our pH is maintained by certain buffers in the body. So the function of buffer is to maintain normal pH. So as you know, there is respiratory acidosis, respiratory alkalosis, metabolic acidosis, metabolic alkalosis and all. That is very commonly asked in biochemistry, but that can be asked in physiology as well. So buffer system in kidney. Okay. So what are, can anyone answer what are the buffer system? What is a very important buffer in kidney which maintains our pH? Shashank, Malini? Yes, Kumar? Buffer system in kidney. Let's see, this is important, guys. So very important RGUHS question. Very important. Buffer system. I'm just waiting for your reply. Bicarbonate buffer. Very good. So bicarbonate buffer. Good, Malini. Good answer. Sir, bicarbonate. एक होता है bicarbonate. One more is phosphate buffer. Phosphate buffer. So phosphate buffer. One more is ammonia. So three important buffer. So all of you write in the chat box. So three important buffers. So bicarbonate, phosphate, and ammonia buffer. So again, there are blood buffers as well. So all these are renal buffers. Write this in chat box. Bicarbonate, phosphate, and ammonia. So in exam, you need to write about the bicarbonate buffer. So very important. All of you concentrate. So this is very, very important. Very commonly asked in the exam. Yes, good. Now look at this. You need to start with the bloodstream. Okay. So this is the bloodstream in exam. Then you have to write the proximal converted tubule, PCT. So as you know, PCT is the major site of absorption of sodium and the glucose. And we have lumen of proximal tubule. So lumen of proximal tubule. There is one more very commonly asked question is acidification of urine. So that is also important. Okay. So yes, let's start now. So what happens in the bloodstream? So as you know, sodium should be absorbed at any cost. Okay, sodium is very important ion, so that is very important for action potential and for other functions. Okay, so sodium should be absorbed. So for that we need ATP, and sodium goes in. So sodium goes in into the bloodstream, and H plus will go out. So H plus will go out into the proximal converted tubule. So this H plus combines with the HCO3. HCO3, that is nothing but bicarbonate ion. So it forms the H2CO3. It forms H2CO3. So okay, basically CO2 and H2O, that forms H2CO3, and this divides into H plus and HCO3 minus. Now this H plus is there. It will again enter into the lumen of the proximal tubule. So again ATP is used and Na plus is absorbed. Here H plus combines with the HCO3 and becomes H2CO3. With the help of a carbonic anhydrase enzyme, it becomes H2O and CO2. CO2 again diffuses back into the proximal converted tubule. CO2 combines with the H2O, it forms H2CO3 and the same cycle. So this is very important buffer to maintain pH in the kidney. This is known as bicarbonate buffer. So in exam, all of you remember, you need to start with the bloodstream, proximal converted tubule, and the lumen of the proximal tubule. That is basically the site of excretion, right? So the very important buffer is this. Okay, can you able to write? Dora, Charan, can you able to write this diagram in exam? If you write this diagram with few points, you will get at least 2 mark out of 5. 2 out of 5 you will get. So is it clear, guys? Any doubt in this? Dora, Charan, practice this. This will again come in your biochemistry. Very important. Shashank, are you there? Shashank, can you able to write this? Yes, Shashank. I think this will be a pakka question probably in upcoming exam, because many times this was asked. So next we are going to discuss about hemophilia. So very important question. See, hemophilia, as you know, it's a condition, so it's a deficiency of a clotting factor. So there are 3 types of hemophilia. So hemophilia A, B, and C. Okay, and parahemophilia. Can anyone tell me? So what is deficient in A? What is deficient in B? What is C? And parahemophilia? Parahemophilia. So definition you need to write. It is because of the deficiency of the clotting factors. So what is A? Hemophilia A. What is hemophilia B? And what is hemophilia C? And parahemophilia. And you need to write about the clinical features. And you need to write about the treatment also, and also you can mention about the the inheritance as well. Inheritance, hemophilia. So all of you remember. So hemophilia. So hemophilia A because of the factor 8. So hemophilia, because of that is factor 8. It is X-linked recessive. It is XR basically. XR, X-linked recessive. Hemophilia B, that is 9. So that is also X-linked recessive. Hemophilia C, that is 11. Paramophilia, that is 5 actually. 5. And both are autosomal recessive condition. Both are autosomal recessive condition. So all of you write in the chat box, hemophilia is equal to 8, 9, 11 and 5. 8, 9, 11 and 5. So you can write in the chat box, hemophilia is equal to 8, 9, 11 and 5. So types of hemophilia, this is very important MCQ as well. So I said hemophilia A and B, AB are X-linked recessive, C and paramophilia, they are basically autosomal recessive condition. So write this in chat box. Shashank Pujar, all of you write, keep writing guys. Now let's see what are the clinical features. What are the clinical features? So one very important clinical feature is nose bleeding. Okay, nose bleeding, that is known as epistaxis, right? So and also there can be bleeding gums. So bleeding gums can be seen in scurvy as well and hemophilia as well. Swollen joints, so that is known as hemarthrosis. So there can be bleeding into the joint, so and swelling around the joint, and sometimes the joints become non-functional as well. Bruises, easy bruises, minor trauma, there can be bruises. So vomiting of the blood, so that is known as hematemesis or hemoptysis also. Hematemesis and hemoptysis. So blood in the stool and the urine and heavy menstrual bleeding. So all these are the features of hemophilia A. Hemophilia A. This is very commonly asked in the exam. Good. So yes, so this is about the nosebleed. So all of you try to remember nosebleed and gum bleed. Nosebleed, gum bleed, hemophilia. Scurvy also same. Okay, nosebleed and gum bleed. Usually gum bleeding basically. Scurvy is because of the vitamin C deficiency, because of the deficiency of the effective collagen synthesis. That is scurvy. So this is basically hemophilia because of deficiency of factor 8. Factor 8, factor 9, 11 and 5. Okay. So clinical features you can write. So and also in exam, so the clotting factors can be asked, especially clotting factors as a MCQ. So there are 11 clotting factors. So that mnemonic is there, a very interesting mnemonic, old mnemonic basically. Fresher party today, fresher party today. So we will have party after the exam. Come on, yes, come on, let's sing and call seniors, please have. Something like that. If you want, you can remember. Otherwise, I remember directly. F for fibrinogen. So the hero is the fibrinogen. Very important. So the first one also fibrinogen, last one also fibrinogen. Remember, first one is fibrinogen, last one is fibrinogen, fibrin stabilizing factor. 2 is our prothrombin, a tough guy, pro guy. Then thromboplastin 3, calcium, our calcium, Ca double plus is there, no, Ca plus plus, you can remember 4 alphabets. Ca is 4, plus plus, no, that is 4, calcium 4. 5 means, labile factor, okay, factor 5, labile factor, labile. So after labile, stable, so stable. Then 8 already we discussed, anti-hemophilia factor. 9 is Christmas factor, okay, 9 is Christmas factor. 10 is Stewart Prova factor, and plasma thromboplastin antecedent, that is the 11. Hegeman factor is 12, and fibrin stabilizing factor is factor 13. So this is very simple concept and very commonly asked MCQ. So there are 13 factors are there. Okay, yes. So first and last, both starts with the fibrin. All of you right? Factor 1 and factor 13, they starts with the fibrin. You can remember like this, fibrin. And factor 4 is, that is basically 4. You can write the mnemonic also. This is how I remember. And 5 is basically, 5 is there, no? 5 is labile. So labile. 6 is basically stable. So 6 for S for stable. So this is how you can remember. 8 will remember anti-hemophilic factor, Hageman factor. So this you can write in the exam. So any question asked in hematology, especially clotting pathway, if you have time, you can write this coagulation factors. So this will be very good to see in the exam. Chalo. Oh, okay. Yes is basically not 6. 6 is absent. Stable factor, that is the 7th one. Yes, I forgot to tell you, 6 is absent. So next is about the thalassemia and sickle cell anemia. One important question. So thalassemia and sickle cell anemia. So Here you can write this is 7. Okay, 7 is also same, stable factor. Good, Malini. Good. Thank you. Then comes is your thalassemia and sickle cell anemia. So two important questions. Sickle cell anemia can be a clinical based question, very commonly asked. Sickle cell anemia. Can anyone tell me what is the classical presentation of sickle cell anemia? What is a normal presentation? How do patient come in history of sickle cell anemia or in a patient suffering from sickle cell anemia? Yes, Malini. Yes, hemophilia 8, 9, 11, 15. Okay, Renika Babu, that's okay. So, chalo. So, thalassemia. See, thalas means grade C. Okay, thalassemia means grade C. Alpha thalassemia and beta thalassemia. So, alpha thalassemia, deficiency of alpha chain. Beta thalassemia, deficiency of beta chain. So, as you know, hemoglobin has alpha and beta, alpha 2 and beta 2. So, when alpha is not there, so definitely there will be death. So, beta thalassemia, again, beta thalassemia major and minor, intermediate and all. So, that we are going to discuss in pathology. So, sickle cell anemia, also very important. My question is, what is the clinical presentation of sickle cell anemia? Because it's a clinical based question. Come on, Shashank Pujar. So, autosomal recessive, okay, autosomal recessive, that's fine. Okay, okay. Hemophilia, thalassemia, fine. So, all of you remember this very important one. So, this is what you need to write. So, sickle cell anemia. So, the main clinical feature is the pain. So, pain in the periphery, okay, because of the sickling crisis. So, there can be abdominal pain and all. So, sickle cell anemia, because of what? So, the glutamic acid, you can remember good guy. So, glutamic acid is a good guy and he is replaced by a villain. Who is the villain? Valine. Okay. So, again, there is a confusion in exam. That's why, remember, glutamic acid, good guy. Valine is a villain, is a bad guy. At the 6th position of beta chain. Okay, you must be knowing 6th position of beta chain. So, all of you write. So, good guy. So, good guy is our glutamic acid. So, glutamic acid, not glutamine, all of you. Glutamic acid. And valine is our villain. So, valine is a bad guy, our villain. Okay, bad guy. Okay. Yes, come on, guys. Come on, guys. At the 6th position of beta chain, sickle cell anemia, sickle cell crisis, you need to write in the exam. So, in exam, what you need to write? You need to write about the inheritance. So, inheritance, I think Shashank Pujar answered. Sir, it is autosomal recessive. Point number 2. So, it is, replacement of glutamic acid by the valine in 6th position, you can write. So, it affects the hemoglobin. So, there will be sickle shape of the RBC, sickle cell. Pathogenesis. So, pathogenesis. So, sickling crisis. You can write about the sickling crisis. Clinical features I said already. So, vaso-occlusive crisis. So, there can be pain. Then there can be hand-foot syndrome. I said it commonly affects the periphery and the capillaries. Avascular necrosis, especially in the bones. Then there can be painful abdominal pain is very important. And there can be stroke as well. In some individual, there can be stroke, or there can be sequestration crisis, there can be aplastic crisis, parvovirus infection, there can be priapism. Priapism means painful erection of the penis. And there can be bleeding from the nose, that is known as epistaxis, and there can be renal involvement. So investigation, so you can do investigation, anemia, thrombocytopenia, leukocytosis, Howell-Jolly bodies. There can be Howell-Jolly bodies, and you can do sickling test. Again, this is asked. So what is the substance used in sickling test? Your answer must be that is sodium metabisulfate. Sodium metabisulfate, and radiograph also you can take, and hemoglobin electrophoresis also you can do. So, and the management is symptomatic, and write about the symptomatic treatment. So this is what required in exam. Sickle cell anemia. So you need to write about the inheritance. You need to write about the pathogenesis, the clinical features, investigation, and management. If you write, you will get definitely 3 out of 5. 3 out of 5. Is it clear, guys? Malini? So Likith, who is the bad guy? Valine. So valine is a bad guy, glutamine is a good guy. Glutamic acid is a good guy. 6th position. Good. So all are writing, that's great. Is it clear, Charan? Can I able to write at least 50% of these notes? 50% you can take the screenshot and you can save and you can revise just before the exam. Okay, just before the exam. And I'm telling you, from these 2 classes, there will be at least 5 question repeat, at least 5 or 6 repeats for sure. And we'll have discussion after the exam. So Charan, can you able to write? Malini? Can you able to write all the points whatever shown in the image? Malini, Charan, Likit Balakrishna say yes sir. Yes sir, I can. Shashank Pujar. Shashank Pujar. Okay, that's great. Sickle cell anemia, very commonly asked. Chal. Then you can remember one more. What are the features in thalassemia? So what are the peripheral smear findings in thalassemia? So when thalassemia asks, you can write mnemonic thal. Thal. Okay. So one of my favorite movie is Thal. Okay. So do you know who is the hero and heroine in that movie? Thal. Okay. T for target cell and A for anisocytosis. Target cells basically look like this. Okay. This is the target cell. Okay. So this is the target cell. Target cell. Anisocytosis, that is different size of the RBC. Low MCV, that is less than normal, that is less than 80, less than 70. Hovel jelly bodies, H for Hovel jelly bodies, and hepatosplenomegaly. So this is Thal. So my favorite mnemonic, Thal is the mnemonic because Thal is my favorite movie. So target cells, anisocytosis, low MCV, Hovel jelly bodies, hepatosplenomegaly, and this is the feature of peripheral smear in thalassemia. Thalas means great C, great C. You are great. That is thalassemia is great. So around the Great Sea, Mediterranean Sea. So this was very prevalent under the around the Great Sea. That's why. Yes. No. Have you seen that movie? Like it, Charan. Do you know Thal movie? Very old movie. Okay, 90. I think 90 or maybe 2002 K movie. Aishwarya Rai is the heroine, and Shah Rukh Khan. Shah Rukh Khan. Okay. Good. Chalo. I hope you will remember Thal. So just thalassemia is equal to Thal. Thalassemia is Thal. Thal. Just write thalassemia is equal to Thal. So this can be asked in your exam. I'll go a little slow today. But anyway, tomorrow time is there for you to read. So Malini, just write Thal. Thal, Thal. ठीक है? This is fine. Okay. So we discussed about two important questions. One is sickle cell anemia. Second one is thalassemia. Both are very frequently asked clinical based questions. Shah Rukh Khan. Yeah, Shah Rukh Khan. ठीक है. Good guy, bad guy, that is okay. Sickle cell anemia, that is okay. Next comes is our one of the most difficult question, that is Bohr effect. Very boring. Bohr effect. Haldane effect. So two important things. So Bohr effect and Haldane effect. So can anyone tell me where they are going to occur? Malini, Charan. So where this Bohr will occur? So Bohr ellagutte. Haldane ellagutte. Haldane ellagutte. Okay, tell me the location where this is going to occur. Bohr effect and Haldane effect. So the first point, Thala for a reason. Okay, Cristiano Ronaldo. Thala for a reason. ठीक है यार, ठीक है. ठीक है. Anil Kapoor. Who is Anil Kapoor? Why Anil Kapoor? Anil Kapoor hero. Oxyhemoglobin curve, right? Yeah. You tell me what is Bohr effect. Where is this going to occur, and Haldane where it is going to occur? So first thing, what is the site of Bohr effect? What is the site of Haldane effect? You just tell me that. Then we'll have a discussion. Yes, oxyhemoglobin dissociation curve. That's right. But 3 marks question. So you need to define about the Bohr and what is the mechanism in 1 or 2 lines. Okay, Bohr and Haldane. So all of you, just there's a mnemonic for that. Okay, I'll show you that what happens actually. See, Haldane is there, no? Haldane and Bohr. Haldane and Bohr. So remember, the Haldane occur in alveoli. Bohr occurs in organs and tissues. So write this in chat box. So Haldane affect in alveoli, Bohr occurs in organs. How to remember? O for organs, L for alveoli. So you can see here the notes, occurs in alveoli of the lung. So what happens in alveoli? So there will be oxygenation, right? There will be oxygenation. So oxygenation will occur. So because of that, what happens when there is oxygenation? So that causes release of CO2. So oxidation of hemoglobin promotes the dissociation of H plus from the hemoglobin. So H plus combines with HCO3, it forms CO2. So CO2 released from the RBC. So CO2 released from the RBC. So what happens finally in the Haldane effect? High O2 level. So as you know, alveoli, high O2 level. High O2 level in alveoli promotes CO2 release from the RBC. So this is the definition. This one word you need to write in the exam. I'll repeat again. High O2 level, high oxygen level in alveoli promotes CO2 release from the RBC. RBC means hemoglobin. So this is about Haldane effect. Okay. Now ulta in Bohr effect. So Bohr effect occur in organ. Organ means tissues where O2 level is less. Okay. So in peripheral tissue, H plus from the tissue promotes the uploading of O2 from the hemoglobin. So there is a more and more H plus ion in the tissues. We have more H plus ion in the tissue. So tissue will take more H plus ion. Say we have more H plus ion, take like that. So when there's a more H plus ion, that will cause more release of O2, oxygen. So high CO2 level in the peripheral blood, H plus ion, promotes the O2 release. O2 release. So this is known as Bohr effect. So Bohr effect occur in the tissues. Haldane effect occurs in the, that is alveoli. This is very, very important. So Haldane, alveoli, Bohr is the organ. So this you have to mug, okay? This is very important. This can be asked in your biochemistry and Viva as well. Is it clear, guys? Say yes or no, is it clear? Clear, come on. Cristiano Rathod, RBC, RCB. Okay, what is that? Okay, Haldane, I am alveoli. Okay, Likit is telling Haldane, hi, hello, Haldane, I am alveoli. Good. So, and Bohr is telling, oh, Bohr, man, Bohr, I am argon. Good. Good, Likit, you are helping me to create some mnemonics. So, Haldane, hi, hello, Haldane, Haldane in alveoli. So, Bohr basically argon and tissues. So, you can remember like that. So, that is also okay. Yes, Likit. You can write chloride shift and all, you can expand this answer. So this is a basic answer you need to write in the exam. Rest you can expand by going through your standard textbook. Yes, Charan, okay, are you enjoying? Are you sleepy? Charan, don't sleep. You have to read up to 2 o'clock today. You need to get up at 5 o'clock, 5 o'clock at 6 o'clock. So tomorrow full day, nobody will disturb you. No online class tomorrow. So you can study. Okay? Cristiano Ronaldo. Cristiano, very good name. Good. Haldane and Bohr. So ये समझ में आ गया आपको. चलो. Next comes is our body fluid compartment. Simple question from general physiology. Body fluid compartment and how to measure this body fluid. So as you know, intercellular fluid and extracellular fluid. Very simple question, but sometimes it can be tricky question. So remember total volume. So total volume is around 42 liters. 42 liters, 60% of our body weight. 60% of our body weight, the human body, 90 kg, 80 kg, 70 kg. So 60% made up of water. Water everywhere. So again, intracellular means inside the cell. That is around 28 liter. And extracellular 14 liter. So 28, 14. 28, 14. So all of you write 42 is equal to 28 plus 14. 28 plus 14. Write this in chat box. Just write the word 42, 28 and 14. Again this 14 intravascular, that is 3 liter. Plasma is there, no? That is 3 liter. So total RBC and blood is around 5 to 6 liter. So 3 liter basically plasma. Extravascular 11 liter. In extravascular, interstitial fluid that is basically 10.5 and transcellular that is 0.5 liter. Interstitial between the two cells that is basically 10.5. So transcellular that is 0.5. So all if I write 42 is equal to 28 for 14. 14 again 3 and 11. 11 again 10.5 and 0.5. This is basically in male. Okay, in male. You can say this is a male. Okay, chala, good. This is okay, fine. So next comes is your how to measure the body fluid volume, how to measure total body water, how to measure extracellular fluid, How to measure intracellular fluid, plasma volume, blood volume, and interstitial fluid. So this you need to write in the exam. Okay. Antipyrin for total body butter. Inulin for the extracellular fluid. Okay. Inulin is for extracellular fluid. You can write ECF is equal to inulin. Write this in chat box. Okay. And plasma volume by using albumin. Okay. So rest all you can remember. Okay, so just write extracellular fluid ECF volume, that is by inulin. So all of you remember inulin clearance test, creatinine clearance test, very commonly asked in the exam. So this is one very important question, very important question. Okay, chal. So next comes is your feedback mechanism. Feedback mechanism. So you know positive feedback and negative feedback. So what are the examples for positive feedback? Let's see who is going to answer. Positive feedback and negative feedback. And negative feedback. Negative feedback. Can anyone answer? What are the examples for positive feedback and negative feedback to maintain homeostasis? Homeostasis, guys. Yes. Okay, Malini is telling, sir, parturition, childbirth. Good. So she's telling, sir, childbirth. Childbirth is positive. And one more is blood clotting mechanism. So clotting mechanism. Negative. 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 Okay, lick it, very good. Childbirth, okay. Negative, you know, especially heat. Regulation of heat, regulation of cold, hormones. So most of the mechanisms in our body, they are negative feedback mechanism. Okay. Okay, negative feedback is common than the positive feedback. You can write the examples as well. So you can write here. So positive feedback mechanism, negative feedback mechanism. So positive feedback causes amplification. So positive feedback causes what? Amplification. So 1 become 2, 2 become 20, 20 become 200, like that, amplification. So negative feedback, that basically causes inhibition or slowing down of a process. So what happens? Slowing down of a process. So all this we can write. Examples also you can write. And most of the hormone, most of the optimal internal homeostasis mechanism by negative feedback mechanism. Okay, this you can write. So all of you write. Negative is common. So negative is common process. Negative is common process. Okay, how to remember? Negativity. Exam time, negativity very common. Okay, negativity, anxiety, stress. ನಾನು ಫೇಲ್ ಆದರೆ ಏನಾಗುತ್ತೆ, ಫೇಲ್ ಆದರೆ ಮನೇಲಿ ಏನು ಅನ್ಕೊಂತಾರೆ, ನನ್ನ ಫ್ರೆಂಡ್ಸ್ ಏನು ಅನ್ಕೊಂತಾರೆ, ಓನ್ಲಿ ಕಂಪ್ಯಾರಿಸನ್. ಓಕೆ, ಇವೆಲ್ಲ ಸ್ಟಾರ್ಟ್ ಆಗೋದು ಎಕ್ಸಾಮ್ ಟೈಮಲ್ಲೇ. ಸೊ ಆಲ್ ದಿಸ್ ನೆಗೆಟಿವಿಟಿ ಆ್ಯಂಡ್ ಆಲ್ ದಟ್ ವಿಲ್ ಸ್ಟಾರ್ಟ್ ಆನ್ ಎಕ್ಸಾಮ್ ಡೇ ಆರ್ ಒನ್ ಡೇ ಬಿಫೋರ್ ದ ಎಕ್ಸಾಮ್. So negativity, a negative mindset, very common in MBBS day, especially first year MBBS. It's very common. And the next day, that is probably next phase is during your preparation for NEET PG exam. PG preparation are common. Second year, third year, final year usually ಏನು ಆಗಲ್ಲ, because carry over system ಇರುತ್ತೆ. But first year is the day negativity is very common. Negative mindset. So the common things right now in your mind, I can tell you. ಸ್ಟ್ರೆಸ್ ಇದ್ದೇ ಇರುತ್ತೆ ಎಲ್ಲರಿಗೂ. ಸೆಕೆಂಡ್, ಕಂಪ್ಯಾರಿಸನ್ ಕಂಪೇರ್ ಮಾಡ್ತಾ ಇರ್ತೀರಾ ನೀವು. ಸೊ ನನ್ನ ಬ್ಯಾಚ್ಮೇಟಿಗೆ ಏನು ಬಂದಿರ್ಬೋದು, ಸೊ ನನ್ನ ಫ್ರೆಂಡ್ ಏನು ಆನ್ಸರ್ ಮಾಡಿದ್ದಾನೆ, ನಾನೇನು ಆನ್ಸರ್ ಮಾಡಿದ್ದೀನಿ, ಕಂಪ್ಯಾರಿಸನ್. ದೆನ್ ಆಂಗ್ಸೈಟಿ. ಸೊ ಮನೇಲಿ ಏನು ಅನ್ಕೊಂತಾರೆ, ಸೊ ವಾಟ್ ಹ್ಯಾಪನ್ಸ್ ಇಫ್ ಐ ಫೇಲ್. Okay, all these are very common. Okay, these are very common. And even 90% of the students, 100ಕ್ಕೆ 90% ಸ್ಟೂಡೆಂಟ್ಸ್ಗೆ ಇದು ಇದ್ದೇ ಇರುತ್ತೆ, ವೆರಿ ಕಾಮನ್, ಇನ್ಕ್ಲೂಡಿಂಗ್ ಮೀ. ನಾನು ಓದಬೇಕಾದ್ರೂ ಸೇಮ್ ನೆಗೆಟಿವಿಟಿ ಎಲ್ಲ ಇತ್ತು ನನಗೆ. Now I cleared everything. Now I am always positive. No negativity. If you see, 100% positivity only. No negativity. You can ask my offline students. So they will tell you, in better way than me. है ना चरण? Charan, always positive. Be positive. Be positive. Charan, Shashank, stay positive. B positive. So many examples. So you can write BP, baroreceptors, chemoreceptors, and all negative feedback mechanism. So do you agree with me, Malini? Sharon? Sir, I want to become physician, general medicine. Okay, you will become. Okay, you don't worry. You are going to become one of the good physician. So, okay, very good. Keep it up. Keep going. Charan, positive. So, Charan, yes, stay positive. Be positive. Okay. Shashank Pujar. Shashank Pujar. Acha, Likit is telling, sir, my blood is also B positive. Great, man. Great. Shivu MBBS telling, sir, yes, sir. Yes, sir. Shivu, great. So, great. That's fine. No, not like that. Buffers are there. Acidification of urine. Okay, one very important question: acidification of urine and tabuloglamular feedback mechanism. Okay, okay, tabuloglamular feedback mechanism very important. Don't do that, Bima. You have to read all the topics which I discuss in the class as well as your notes. Okay, and the last question. Okay, ninth one: anticoagulant. Anticoagulant. So what are anticoagulants and the classification, and they can write they can tell about the they can ask about the heparin. So heparin basically. So Charan, yes. So anticoagulants basically there are many. So in physiology you need to write like this anticoagulant. Let's see, where is anticoagulant classification. Before that I think, yeah, it must be here. In vitro, in vivo, that classification you need to write. So this is what you need to write in the exam. Anticoagulant used in vivo. Used in vivo. Vivo andre, that is basically, so that is in the body, right? Vivo. So what are the examples? Heparin. So heparin is a parenteral. So it is given parenteral route, not the oral route. Low molecular heparin, fondaparinux, and danaparoid. So and direct thrombin inhibitor. Example, you can write one example. Then oral anticoagulant, you can write one or two examples. So in vitro also you can write sodium citrate is one example for vitro. Sodium citrate. Yes. Heparin. Okay, that's fine. Then the clotting pathway. So clotting pathway is very important. So can anyone tell me what are the clotting factors involved in intrinsic pathway? Intrinsic pathway and extrinsic pathway and common pathway. Just go through the image. Just try. What are the factors involved in clotting pathway, intrinsic pathway? What are the factors involved in extrinsic pathway? What are the factors involved in common pathway? Just try yourself. Then I will have discussion. Malin double oxalate, okay. Oxalate is also anticoagulant, okay. Double oxalate, sodium citrate, calcium EDTA, okay. All these are in the vitro. Heparin, low molecular heparin, warfarin. Warfarin is the oral anticoagulant. Okay, warfarin is contraindicated in pregnancy. It can lead to so many serious side effects in the newborn. Okay. Yes, so 12, 11, 9, 10 for intrinsic pathway. So Renuka Bob is telling 12, 11, 9, 10. So do you agree with the 10 as well? You are right, 12, 11 okay, 9 okay, 10. 10 is what? 10 is intrinsic pathway or it is a common pathway? What is that basically? So you can see here, remember, so one common pathway, no, X. So our target is X. So your target is X. X andre yaru? Not X, EX. X andre 10. So start with the 12. 12. 12 ಆಗುತ್ತೆ. 12 will activate 11. 11 will activate 9 and becomes 8. Okay, this is 12, 11, 9, 8. 12, 11, 9, 8 intrinsic pathway. So, and it activate 10. But here it is 7. In extrinsic pathway, it is 7. Then this 10 will activate 5. 5 will activate 2. The 2 will activate 1. Okay, remember 10 half is 5. The 5 half is 2. 2 half is 1. You can remember like this also. So this is common pathway. So this is how you can remember 12, 11, 9, 8 and 10 and 5 to 1. 5 to 1. Yes, good. Next important question is jaundice. So this can be a clinical question, especially from the liver. Okay, jaundice. So what are the types of jaundice? So what are the types of jaundice and the causes? Jaundice, very important image. So prehepatic, what are the causes? Prehepatic, hepatic, and posthepatic. Posthepatic. Can you tell me one causes of this prehepatic, posthepatic causes? Jaundice. Come on, guys. Come on. No, I'm not 100% sure. So how can I complete all entire physiology in 2 hours? I know. So they all commonly asked question. So my prediction. So my prediction will be accurate for some time. So don't worry, you will get some repeats from these topics. Okay, hemolytic. Okay, Malini is telling sir hemolysis. Okay, good. So prehepatic basically hemolysis. Hemolysis. Cirrhosis is the common cause. Hepatitis can be a cause. So post-hepatic, that is basically gallstones. Okay, gallstones. So it's a basic point. Okay, basic causes. One cause you need to mention. So hepatic causes cirrhosis. Pre-hepatic, before hepatic, that's basically RBC lysis from the hemolytic anemias. Post-hepatic basically gallstones. So you can write this. Okay, you can see here. This is very important. Prehepatic, what are the causes? You can see here, very interesting image there. So prehepatic, transfusion reaction. Transfusion reaction. RH incompatibility, ABO incompatibility, sickle cell anemia, valine and glutamic acid, thalassemia, grade C, autoimmune hemolytic disease. So all these are basically prehepatic causes. Now hepatic causes. Hepatic, what are the causes? I said already, hepatitis, cancers, hepatocellular carcinoma caused by hepatitis B. Okay, cirrhosis, very important, are congenital abnormalities. Dubin-Johnson syndrome, Crigler-Nazar syndrome, and all. Dubin-Johnson syndrome, Rota syndrome. So all these are basically hepatic causes. Now post-hepatic, you can see here post-hepatic. So one is gallstone. So gallstone is the commonest cause. Or it can be tumor. Like example, pancreatic tumor, tumor of duodenum. Any tumor can block the basically the intestine, that can lead to post-hepatic jaundice. So pre-hepatic, hepatic, and post-hepatic. So is it clear? So yes, Malini, is it clear? This is very important one, very commonly asked. Very interesting image, guys. Very interesting image. Is it clear? Pakka question, guys. This can be question in biochemistry as well. And this image is so nice, very nice to remember. You can see here, largest organ in the body, hepatic. You can see RBCs here, small RBCs. And this is what your gallbladder. Okay, you can see that this is gallbladder. What is the function of gallbladder? So that is the storage of bile. So you can, gallbladder stone is there. 5F we discussed in anatomy class, right? So gallstones can obstruct this. So this can lead to jaundice. So this is very interesting. So I think in anatomy class we discussed what are 5F of gallstone. What are 5F? 5F. Can anyone tell me? 5F. Come on, 5F. Yes, come on, guys, come on. So 5F of gallstone, one is female, 40, fair, then what? Fatty, and fertile, Female, fatty, fair, 40. Yes, good answer. Good. That's great. Oh, this is the basic one. Now in exam, you need to write about this important table, very important table. Types of jaundice, prehepatic and all. So what type of bilirubin? So type of bilirubin in prehepatic is unconjugated. Unconjugated. So as you know, conjugation occurs in the liver. So prehepatic unconjugated. So unconjugated is lipid soluble. It can lead to kernicterus. It can accumulate in the brain, can lead to kernicterus. So hepatic basically conjugated, unconjugated. So certain amount of bilirubin conjugated, certain amount is unconjugated because liver is not functioning normally. But in case of post-hepatic, it is conjugated. So conjugated. All of you write in the chat box. Post-hepatic is equal to conjugated. Conjugated. So post means after. So post means after. So after marriage, conjugated or non-conjugated? So all of you, after marriage, conjugated only. No. So conjugated hyperbilirubinemia. And this is water soluble. Conjugated is water soluble. Conjugation occurs in liver. So again in biochemistry, so detoxification reaction, phase 1 and phase 2. The phase 2, that is basically the conjugation, glucuronide conjugation, right? Okay, good. Post hepatic is basically conjugated. Good. Likit Balakrishna, everyone just keep writing. Next point, serum bilirubin indirectly positive, biphasic, direct positive. So what is the test, all of you? What is the test to differentiate between indirect positive, direct positive, and biphasic? What is the test? It is there in the table. Can you write what is the name of the test? Very commonly asked in the exam biochemistry. Vandenberg test. Vandenberg test. Then urine. So what happens in the urine? So urine, conjugated bilirubin absent, urobilinogen present, bile salt is absent. So in prehepatic, urobilinogen is present, but bile salt is absent. But in case of hepatic, so all are positive. But in case of post-hepatic, urobilinogen is absent. Urobilinogen is absent. Can you tell me why urobilinogen? Why urobilinogen is absent in post-hepatic jaundice? Vandenberg test. Sarmaji? Okay. Why urobilinogen? What is the basis of absence of urobilinogen in post-hepatic jaundice? Post-hepatic jaundice. Okay, you can answer. In between, I'm going to discuss. Urine color, normal. Normal. So, dark in case of hepatic, but very dark in case of post-hepatic because of the urobilinogen. Stool color, dark brown. So, but here it is clay color stools. Very important question. The clay color stool. Okay. So, that is seen in case of obstructive jaundice. Clay color. Yes. Why? Then AST, ALT very high in case of liver disease. So, but it is increased in case of post-hepatic also. So, this you need to write in the exam. Okay, this is okay. Understood? Fine. Chalo. Then other important questions you can go through. One is hazards of blood transfusion. Very important. Hazards of blood transfusion. Important question. 3 marks question and 5 marks question. Hazards. Iron overload, volume overload, infections, anticoagulant toxicity. You can write. So many things you can write. Then comes is dysbarism. 5 marks question. Dysbarism. Dysbarism. Okay. And one more question. Okay. That is mountain sickness. Mountain sickness. So very important. Inulin clearance. Renal function test. Renal function test. Inulin clearance. Creatine clearance. Then this is very, very important question. Counter current multiplier system. Counter current multiplier system. Important one. Characteristic features of coronary circulation. Very important. I think last year the question was actually features of coronary circulation. Last to last year, what are the features of pulmonary circulation? Both are important. Then glucose absorption and renal splay. Renal splay. Difficult one. Surfactant. Very, very important. Surfactant. pneumocytes, surfactant, hyaline membrane disease, the composition, functions. They prevent the damage, collapse of the lung, alveoli collapse. RMP. What is the physiological basis of RMP? Resting membrane potential. Action potential. Action potential. Then one important is that is muscle contraction. Okay. Muscle contraction. Sarcomere, muscle contraction, very important. The steps involved in muscle contraction from the general physiology, very, very important. Okay, muscle contraction. And also the action potential in cardiac cell, that looks different. Then hypovolemic shock. Methods of artificial respiration. So methods of artificial respiration. So these are 40 important questions. So that can be asked in your upcoming exam as a short essay, or it can be a long essay. So there are others as well. So I think these are all important topics. So just go through all the 40 topics. Just go through, and we can make notes as well. So this completes your session. So all of you, if you have any doubt, you can ask me. Ask me. Muscle contraction important, yeah. This I cannot guarantee. Okay, Manasa Yadav. So passing rate area 50%. Okay, 50%. So you need to get at least 50. Just target should be 50. Okay, 50. So 40, 60, that is okay, but just keep it in your mind, 50. Even if you get 40 in one in paper 2, 40, 40, 80, 70 in the practical, 150 out of 300, pass. Now one more session, 20 more questions we discussed in yesterday class. That is also important. So that's it about the session. Already now it is 12:30. So thank you all. So if you have any doubt, you can ask me. I'll be there for next 5 minutes. So I'll be there for next 5 minutes. If you have any doubt, you can ask me. Yes, bye Shashank. Yes, bye Charan. Yes, VQ ratio is important question. Yes, some student asked me, Malini, yes. VQ ratio important. Yes, VQ ratio. VQ ratio. Important. FEV1 and FEV. Important. So both are important ratio. No, not exactly enough, but it will definitely help you in exam. ನಿಮಗೆ exam will help ಆಗುತ್ತೆ 40 questions. Yes, 35 and 40, yes. So 35 and 55, I think 55, right? You said 55. So it becomes 80, no? 80 plus 70 in the practicals. So it becomes 150. So that means 50%. 50. Shock, yes. Hypovolemic shock, commonly asked. Types of shock, definition of shock, stages of shock. So if you have any general doubt, so regarding preparation, you can ask me. I'll be there for next 5 minutes. So compensatory mechanism in acid-base balance. Yes, that is important. That is important. So respiratory acidosis, respiratory alkalosis, metabolic acidosis, alkalosis, and compensatory mechanism. That is very important in biochemistry as well. Okay, that's better. So instead of writing in paragraph, writing in points is very good method. How to present neatly or important flow chart. Good handwriting, flow chart, underlining, underlining. So basically the content that matters. Okay, the content of the answers. That matters in exam. Not the pages. Okay, not the pages. So Bhima is telling our college gives 19 practicals. That's great. If you get 90, that's okay. But last year ಕೆಲವು ಆಫ್ಲೈನ್ ಬ್ಯಾಚ್ ಸ್ಟೂಡೆಂಟ್ಸ್ ಪ್ರಾಕ್ಟಿಕಲ್ ಅಲ್ಲಿ ಫೇಲ್ ಆಗಿದ್ರು. ಸೊ ಪ್ರಾಕ್ಟಿಕಲ್ ಅಲ್ಲಿ ಫೇಲ್ ಮಾಡ್ತಾರೆ ಕೆಲವು ಕಾಲೇಜಲ್ಲಿ. ಸೊ 70 60 ಕೊಡೋ ಬದಲು 50 ಕೊಡ್ತಾರೆ, 45 ಕೊಡ್ತಾರೆ and ಫೇಲ್ ಆಗಿಬಿಡ್ತಾರೆ. ಓಕೆ, that's good. Bhima, positive, be positive, always positive. Yes, this is about today's session. Thank you all. Yes, I'm in PW mandate. Yes. So how come you know? Yes, BP and regulation. Last class, first question, BP, blood pressure. What is hypertension? Definition of blood pressure, baroreceptors. So what happens when there is a increased blood pressure, decreased blood pressure, RAS pathway, important one. Yes. Supreet, RGUHS, okay. Oh, great. Great. These sessions are really helpful or what? Okay. Yeah, I'm there. Definitely worth. Definitely worth. We have very good teachers. Bunch of great teachers. And live classes. Basically live classes. Student friendly lectures. Student friendly professors. Educators. The better word is educator. Charan, yes. So we are discussing many important questions since last 1 week for the first time. So we used to discuss in offline classes. So for the first time, we're discussing in live classes, YouTube live. Not easy. Not definitely easy. Likit is telling, sir, it reminds us to important question. Yes. So ನಿಮ್ಗೆ ಯಾರಾದರೂ ಒಂದು ಸ್ವಲ್ಪ ಇಂಪಾರ್ಟೆಂಟ್ ಕ್ವಶನ್ಸ್ ಅಂದ್ರೆ ಅಟ್ಲೀಸ್ಟ್ ನೋಡ್ತೀರಾ ನೀವು ಅಲ್ವಾ? That's why. So that's good. That's good. Okay, upcoming batches. So I hope you are enjoying classes, YouTube classes. The images, some mnemonics, something, something new. I think new learning. And this first year exam is always stressful. Okay, very stressful. So it happened in my first year exam as well. So long back, around 15, 20 years back, first year exam. Hmm? So a lot of anxiety, a lot of comparison, a lot of negativity. Hmm? So and very huge syllabus. So yes, that's great, Malini. That is my interest. My subject of interest is that forensic medicine. Hmm? So not only that, I'm good in other subjects as well. Basically tricks, mnemonics, distribution of topics, what to read, what not to read, how to focus. So that is my area of teaching. So what is important is, so what to read, okay, what not to read. That is also important. Okay, there are so many things which are not important in standard textbook. Okay, so certain important questions you must know, certain important concepts. Yeah, yeah. So this is how anatomy, physio, biochemistry, experience, experience matters. So teacher since last 10, 15 years. So in the same field, teaching field, hmm, offline, online, experience. That's all. Nothing else. Nothing special in that. So you will also become good teacher one day. You'll also become good teacher. You don't worry. You have that capability. Hmm? Yes, Likit. Any other doubt? Suprit. Suprit, batao any doubt? You can ask me any doubt. Anything you can ask me. Anything related to exam, anything related to stress, anything about the difficulty you can ask me. Okay. We are there to help you. So all the time, all is well. I can do it. I'll try my level best. This should be attitude. So ಯಾವಾಗ ಟೆನ್ಷನ್ ಆಗುತ್ತೆ, ಯಾವಾಗ ಸ್ವಲ್ಪ ಏನೋ ಒಂಥರ ನೆಗೆಟಿವ್ ಫೀಲ್ ಆಗುತ್ತೆ, ಡಿಪ್ರೆಷನ್ ಆಗುತ್ತೆ, just come out of the room, okay, and just say loudly, all is well, I can do it. Okay, so you can do meditation, you can go for some fast walking for 5-10 minutes, you can have some little chocolates, so whatever that is, you can have some tea, coffee, then you can start studying. Okay, this is how you can plan. Hmm? So positivity is very important. Okay, positive mindset is very important. Yes, meditation, yoga. Hmm? Good. So practice some common diagrams, common flow charts as well. Okay, common flow charts. common flow charts. Like example, baroreceptor. So baroreceptor, the flow chart, chemoreceptors, chemoreceptor, flow chart. So what happens when BP is high? What happens when BP is low? Chemoreceptors, okay, peripheral, central, then intrinsic pathway, coagulation pathway, neural regulation of respiration, apneustic center, pneumotoxic center, gastric secretion, okay, gastric secretion, है ना, cephalic phase, gastric phase, intestinal phase, okay, you can write. So do your best, forget the rest. Yes, everyone is positive. That's a great attitude. That's a great attitude. Great, Malini. Okay. So don't take too much of tension. Okay. What happens here? So pass or fail. Sometimes what happens, instead of getting 70, you might get 60, or you might get 50 or 40. No problem. Anyway, pass no. ठीक है? But give your best. Do your best. Forget the rest. Forget the rest. So have some little breakfast on exam day. Have some plenty of water. Do some 5 minutes meditation just before the exam. So 8:30 ಗೆಲ್ಲ ನಿಮಗೆ ಎಕ್ಸಾಮಿನೇಷನ್ಗೆ ಹೋಗ್ತೀರಾ. So 8:45 ಗೆಲ್ಲ ಮುಗಿಯುತ್ತದಲ್ಲ ಬರೆಯೋದಲ್ಲ. On 5 minutes you can just do some meditation, close your eyes, do meditation, do some prayers, then start writing. Okay? So this will give you some positive vibes. Positive vibes. ठीक है? Think about a difficulty. Think about a difficulty, the struggling of your parents, struggling of your family. So that will give you some more confidence. You know? Yes, Charan. Show. Okay, Gayatri Mantra has a great effect on gamma waves. Okay. Gamma waves, paper 2. Okay. Gamma waves and very helpful. Okay. Good. Noted. Acha. Karmanni. Morpholesu Kadachana. Okay. Great, Charan. Great. So, Charan is multi-talented. Great. Multi-talented. Do that. Likit. Any few words about upcoming exam? Because you are senior and you know the difficulty very well. You can tell our juniors. Okay. Few words. Bhagavad Gita. Fine. Okay. Likit, are you there? Okay. That's it about today's session. Thank you. Bye bye. Happy reading. Acha. So Likit is telling, sir, knowledge and understanding. So Likit, as you said, knowledge and understanding. Very good. Very good points. I agree with that. Knowledge and, yes, knowledge knowledge. So what is knowledge? So your knowledge is your power. Okay. Knowledge is equal to your power. So knowledge comes by discipline. Discipline. Discipline is very important. So discipline in studies, discipline in revision. So revision is most boring, but discipline very important in getting good knowledge. The knowledge one day will make you powerful. Powerful. So discipline, hard work, and revision. And revision. So three important steps. Okay. And one more thing, remember, failure is the first step of success. First step of success is failure. Failure. One day, success. So this is how the flow chart of success looks. Okay. So ಯಾವುದೋ ಒಂದು ಎಕ್ಸಾಮಲ್ಲಿ ತಪ್ಪಾಗುತ್ತೆ, ಇಂಟರ್ ಅಸೆಸ್ಮೆಂಟಲ್ಲಿ ಆಗ್ಬೋದು, ಮೇನ್ ಎಕ್ಸಾಮಲ್ಲಿ ತಪ್ಪಾಗುತ್ತೆ. ಸೊ failure one day you will become very successful, you will become very powerful. Okay. Yes. And one more you must be knowing, impossible is there. Impossible. Impossible. What is impossible? I am possible. I am possible. Impossible word is there? No. I am possible. I am possible. This is what said by APJ Abdul Kalam. APJ Abdul Kalam. Okay, I am possible. So all of you write impossible is equal to I am possible in the chat box. So it will give you some positive vibe. Okay. Consistency, that's okay. Consistency, that's really nice. Okay. Consistency, that's fine. Chalo. So this is about today's session, guys. So it's already 12:45. So let's end this stream. Good, Malini. Good, Charan. Bye bye.